Well, what was presented to us today was a study that is being done at the Children's at the present moment on newborns and premature babies. Basically, it's to reduce the impact of monitoring on these babies, and it's done by wireless monitoring with captors that are being used. So it means that we're able to follow up on the baby's condition at a distance, so the nurse doesn't have to go into the room 6-7 times during each shift, 8-hour shift, and we're able to at the same time to reduce the burden of having all these threads coming out of your body, and this facilitates, of course, bonding between the parents and the baby, and this is very important in young babies and young premature babies and newborns.
Skin to skin has been demonstrated to improve patient care and the patient clinical condition. When the mom holds the baby blood pressure gets better, the temperature gets better, the heart rate gets better, they sense the smell, they sense the temperature of the mom. So there's a lot of science showing it's very important. Kangaroo care is very important. With the wires, we can do that, but it's much more complicated, it's more cumbersome. And some parents are very afraid that the wires will get disconnected, so they hold less their baby because of that. This is new, this is unique, innovative. As far as I know, it's the first time somebody's testing it.
First time when I saw him, he had all these wires, so for his breathing, for his cardiac rhythm, for his intubation tube, his feeding tube, for the temperature. So he had like 6 wires with the IVs as well. So that's quite impressive and stressful for a parent. Like you feel like you've done everything you could, but now he's born and he's on his own. So it's his time to fight. And with all the wires, it's like. So I was approached for the research. So it's like 2 captors, one on the wrist and one on the chest. So obviously it's easier to take your kid in your arms, it's easier to dress him, because it's difficult to find premature baby clothes, and now you have to find some with like double zipper or buttons. And sometimes the wires, it gets into the toes, and it's difficult like to move the baby around. But with the wireless, I think it's a great idea. Like it will bring you closer to normality with your baby, which is not because you're in the intensive care unit. So yeah, that's great.